My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What? This is episode 39. I want to talk about cardiac events, especially in women. We'll touch on men a little bit, but women, it's a rising group of the population which has more and more cardiac issues. So, cardiovascular disease in women. First of all, risk factors. You need to manage your stress. I know you hear me say that a lot. You got to manage your diet. You got to make sure if you're diabetic that you really control your blood sugar, because you can damage the capillaries and nerves leading to the capillaries. Also, if you're smoking, stop. Exercise on a regular basis, even if that means walking, getting your steps in every day. Get a little cardio. And if you're women, for osteoporosis, do some resistance exercise. Everybody can get a set of cheap dumbbells, and you can do a lot with those. A lot of YouTube videos. They're actually good by people that know what they're doing, like physical therapists. So watch those. Also, you want to make sure your weight's in control and your alcohol use is limited or non-existent. So, what are the common cardiovascular diseases and symptoms? Coronary artery disease, clogging of your arteries, plaque building up. Use your floss. That helps a lot. Get it out of your teeth. Helps get it out of keep it from getting in your arteries. You don't want to block those arteries up. You want to keep that healthy DASH or Mediterranean type diet, so you don't have that good sticky fat and high cholesterol and bad cholesterol ratios. Sticky fat in those arteries. Remember that. Stroke, that's when your arteries get blocked or leaking or bursting of blood vessel. You don't want that. And you need to make sure if you've got some weird fatigue or memory loss or any of those things, then you need to check that out. So with that, arrhythmias, a lot of women experience this, and it can be hormone related, but you got to check with your healthcare provider. Have them look at you if you start getting fatigue, lightheadedness, faintness, pounding in your chest, like a panic attack feels like, or arrest may occur in bad, severe cases. Any of those symptoms, have your doctor check you out. And if you're not getting a yearly physical and you're over 30, for sure get a yearly physical. If you're under 30 and you're overweight, get a yearly physical. You've got to change those things. Heart failure, that's when your pump starts going out, and it can be caused by a number of things. Shouldn't be seeing that when you're younger unless it's fairly rare disease types. But as you get older, all these things, if you're pushing against arteries that are clogged, or if you have a lot of stress with just squeezing those arteries by the muscles around them, or any of those things, you get swelling in your feet, your ankles, or your calves, your abdomen or your neck veins, you could see. You need to see your healthcare provider before things get serious, because cardiovascular disease can really be an issue, and it can rear its ugly head as many things and confusing symptoms in menopause. So if you're not seeing your doctor on a regular basis or your healthcare provider on a yearly basis, start doing that. Get a checkout. Let them do the blood work. Clinical tests are a great indicator, as well as being careful to express your symptoms clearly to your healthcare provider. Don't make them a veterinarian. Let them do their job. As a pathologist, I can tell you, the more you say, the more lab tests you have on a regular basis, on a yearly basis, the better your healthcare provider can help you have a healthier, happier 2024. This is Dr. Frank. My doctor said, what? Episode 39. And ask you to watch me on or listen to me on all major platforms. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.